Patient care is one of my favorite things, and I definitely have over the years a lot of moments, including over the weekend here, folks that were just appreciative of me sitting down at the bedside, holding their hand or taking the time to be there for them.
I really love wins for my patients.
A really recent example in my clinic was one of my patients walked in. The patient had recently been diagnosed with Graves' disease and had been started on methimazole in consultation with their endocrinologist. And they came in not feeling well. They were actually jaundiced. And the patient was having a pretty severe medication reaction, a liver reaction to methimazole. And, my CMA, Shauna, recognized that the patient wasn't well. I think the value of having a good primary care team that we know our patients well. And so this patient was able to get worked into our schedule that day, worked her up, figured out what was wrong. We were able to have her see her endocrinologist the next day after we had talked on the phone. And the third day she had surgery to remove her thyroid. And so that's just a really cool story. It seemed like business as usual for us, but this patient is so thankful. And seeing her as she came back out of the hospital is just really cool. And I think, that was a really collective team effort of not only primary care, but specialty care as well. And it's just the reason that we're all here.
Recently, we've had some challenges with access in our clinics. So we have had to add in extra patients or find times during the start of the day or end of the day. The positive feedback that you get from those patients, those parents, is really encouraging. At Unity Point Clinic, we have the new patient experience, which is called NRC, where you get real-time feedback, and the comments that you hear, that just makes you go that extra mile for the patient each time.
I've recently had a few patients that I've known for a really long time that have told me for the first time just how much they really like coming into the office and how they feel like they're coming in to maybe see a friend when they come see me. And that has just been that positive feedback is absolutely treasured in and amongst all of the negative feedback that we receive so often.
Female patient who came in for what I thought was going to be a routine gallbladders outpatient, and everything went fine. We were able to do it laparoscopically, and she went home the same day. When she saw me back in the office, her and her husband were actually in tears. I thought something bad happened, and they were just so grateful. I asked them what happened, and her husband said she hasn't been able to walk or function well for the past 4 or 5 years. And they went to all this neurologist and everybody else, and they really couldn't figure out what it was. And after surgery, she actually had no pain in her abdomen or her neck for the first time in 5 years. She got up and walked around with no pain, and she actually had a garden that she wanted to do for the past 5 years and couldn't because of pain. And now she's back to gardening and is pretty independent. So I'm not saying that always happens, but it's nice to have one of those stories that kind of makes the daily work worth it.
Last week, I was seeing a family who was new to my clinic. They had been seeing another pediatrician prior to me, and this is closer to their home, and they were looking for somebody different, somebody new. And so when I met with them, their child has autism, and they really needed a primary care physician. They really needed someone who's going to provide them with that solid medical home. And I got to the end of a 20-minute visit with them where we discussed a lot of this kid's medical history, but also I got to give them a lot of good guidance on different resources in the area. And the mom made a comment that they had learned more about their child and what is available to him in our community in that 20 minutes than they had in several years prior to that with their previous primary care provider. So it was really a great, it was a nice boost to my ego, but also made me feel like, I'm really doing the job that I'm setting out to do.
When you have a patient who has struggled with their diabetes, or maybe your typical uncontrolled diabetic patient, and you can really flip the script and get that patient to improve, I think is a really rewarding moment. I've had a couple of these recently where we've really empowered patients to take control of their own health. And I think diabetes is kind of a unique situation where the value of patient education and collaborative care is fully on display. And so I think that those types of wins are some of my favorites, and I've had some good ones recently.
I was caring for a patient who was suffering from a heart attack and required a procedure. He was sent from over 90 miles away from his hometown because there were no closer facilities available. That can be very anxiety provoking for many, especially as they get their care elsewhere and in the hands of strangers. That can be very difficult. But it was on the day of discharge that he and his wife expressed their great gratitude for the amazing care that they were provided. And while initially they were nervous to come to our facility, they were grateful there were no closer beds to their hometown so that they could get their care at our facility. I think it's a good reminder of the responsibility we have to deliver the best care regardless of where the patient is from and who the patient is, and that every encounter is an opportunity to demonstrate our brand promise that they matter, and it's an honor that the patients trust us with their care.
Now that I've been part of this community here in Fort Dodge for 3 years, I get to see those stories where I get to hear from either patients or friends of patients or family members who approach us and say, hey, your team took care of a friend of mine or a family member of mine. And I think that's a really encouraging thing to hear.